Newsday continues here on One News Now. I'm Sean Yao. The Octa Research Group has recommended the extension of the current quarantine classification here in the NCR Plus bubble or region in light of the threat of the Delta COVID variant. We have Professor Guido David joining us via Zoom to discuss this further. Good afternoon, Professor Guido. So for how long rather, would you like to extend this GCQ status in the NCR Plus?
Well, Sean, it would depend on the trends that we're seeing in the region. Right now, the trends are very good. Our positivity rate has decreased to 7%. Reproduction number is 0.8, and we're averaging about 667 cases per day. This is close to the pre-surge level of about 500 cases per day in the NCR. But having said that, one of the reasons we support the recommendation of the Department of Health to extend the GCQ is because we still want to be careful about social gatherings. We know that a few weeks ago we had gatherings or parties, social gatherings, which resulted in community transmission and a spike in cases in some barangays. So that's something that we want to avoid. But we do support the expansion of capacities in business establishments, in offices, and even reopening some businesses.
Saying is, of course, to prevent another surge from happening. This is even still without the threat of the Delta COVID variant. Do you think these measures will be enough to prevent another surge? We've been in this for a year now, over a year now, and do you think people have kind of like developed that muscle memory for health protocols?
Yes, well, it's good if they've developed muscle memory for the health protocols. That would definitely help. These measures would help us prevent spikes in cases because of community transmission in barangays or in places where they have social gatherings. It will not likely prevent an outbreak due to the Delta variant at the moment. And that's why we need to make sure that the Delta variant does not get into community transmission in the country, especially in NCR. Based on the information that we have from the genome sequencing, our current information says that the Delta variant has not yet gotten into community transmission in the country based on what we know so far. So we want to keep it this way. So that's why it's important to have strict international border policies, in terms of quarantining people coming from overseas, especially coming from these high-risk Delta areas. I mean, that includes Indonesia, United Kingdom, and other countries. So this is our main main goal right now, to prevent the Delta variant from coming in the country and going into community transmission.
All right, Guido, good to know that the current measures or current border control measures are effective in keeping the Delta variant at bay. But what about the situation in hospitals here in the Philippines? I'm talking about nationwide. Are the numbers still good at the moment? Is utilization at an all-time high, or is it okay? And which places are in the worst spots at the moment?
Utilization in the NCR is very good right now. Based on our latest report, we have 36% hospital bed occupancy, 45% ICU bed occupancy, and 32% mechanical ventilator occupancy. These are all below 50%. They're considered to be safe levels by the Department of Health. However, utilization is still high in areas in Visayas and Mindanao. Specifically, Davao City has 70% hospital bed utilization and 93% ICU utilization. Iloilo City also has high hospital bed and ICU utilization. Same with Cagayan de Oro and Baguio City and Tacloban. So although the trends have started to decrease in many places in Visayas and Mindanao, for example, Iloilo and Bacolod have already seen a decrease in cases, the healthcare utilization is still high, but we're hoping that because of the decrease, the hospitals will start to have more beds available in the coming weeks.
All right, and of course I have to ask you about vaccination. Based on the current pace of vaccination, is it even possible that we can inoculate even 30% of the population anytime soon, maybe by the third quarter or fourth quarter of the year?
Well, it's definitely possible, Sean. We're looking at the current pace. It's about 200,000 jabs per day. If we follow this current pace, we'll be at around 40 million total jabs by the end of the year. This is barely, well, it's a little short of getting to population protection for NCR plus 8 plus 10. So we need to accelerate even further. Our target is about 350,000 jabs per day at least. I think the government was saying that it could do 500,000 jabs per day. If it could, then good, very good. But we need at least 350,000 per day, and then we'll get to 60 million jabs or 30 million people before the end of the year, and that would mean a good Christmas for a lot of us, because we'll achieve population protection in these priority areas, and that will also cause the other regions to have less of a risk in terms of surges in COVID. So in effect, it's indirectly providing population protection to the other more remote areas.
Never ever forgetting that we're all in this together. Now, Guido, I just wanted to know if you have any other recommendations to prevent another surge in COVID-19 cases. This goes for authorities as well as for the public. And as we, of course, experience good numbers, we don't want to be complacent. So what do you suggest we do while we wait for the vaccines to come? Yeah.
Right, Sean. Yeah, we shouldn't be complacent. Even those, especially those who have received one dose of the vaccine, this is not yet sufficient. We need 2 doses of the vaccine to receive protection. We need 2 weeks after the second dose, actually, to be protected. And as people are getting vaccinated, we should be mindful of the others who have not been vaccinated. And that's why vaccinated people still need to wear face masks to protect those who have not been vaccinated. It's for them. It's not for those who have been vaccinated. But, we're seeing the light at the end of the tunnel. We've had 2 million people receive their second dose. This is about 2% of the population. It's still low, but, we're slowly getting there. By next month, we should have a significant number of fully vaccinated people. We're going to have to be talking about the next normal soon and how we transition from the end of the pandemic to population protection and the next normal. So the light is at the end of the tunnel. I know people have been getting fatigued because of the COVID, but we are optimistic that this will end soon. We're seeing this in US and in other countries that have received a lot of vaccines. So we're really just waiting for the vaccines, and then we can have a Merry Christmas. And you could probably have your normal Christmas party there in One News. In Signal.
We'll make sure to send out an invite for you if and when that time comes. Thank you as usual for the optimism and your time, Professor Guido David of the Octa Research Group. All right, let's go to COVID numbers. We have the Health Department reporting 5,600 new COVID-19 cases on Monday. And this has brought the country's total caseload to 1.4 million, some 52,000 of which are still considered active. 84 new deaths were confirmed today, pushing the death toll to almost 25,000. On the other hand, we have total recoveries now at 1.3 million, with 6,100 new survivors logged over the last 24 hours. And in other news, a bulk of pork imports approved under Executive Order 133 is set to arrive starting July. For more details, Shyla Francisco joins us live from Mandaluyong. Hi, Shyla. What do you have for us?
Sean, the Agriculture Department is optimistic that prices of pork will go below 300 pesos per kilo by the third quarter. This comes as 140,000 metric tons of pork imports are scheduled to arrive between July and October. This is part of the additional 200,000 metric tons of imported pork approved in May under EO 133. Under the guidelines, 70% should arrive starting next month and the rest from November to January 2022. The allocation is higher than the 55-45 ratio approved with the DA's technical working group. It is also higher than the agreed recommendation of stakeholders to equally divide it into 12 months. Agriculture Secretary William Gar noted that the first shipments are crucial to see a significant impact on prices. But if so, pork producers warn that the low prices of pork products will only be temporary. This as some raisers will be discouraged to boost production due to the competition with imports. They expect the prices to shoot up again by next year. Sean, the DA, for its part, is banking on its hog repopulation program to boost local production. They also expect this to sustain the lower prices even after the implementation of additional pork imports under EO 133. Sean?
All right, thanks for parsing through that for us. Shyla Francisco joining us live from Mandaluyong City. We'll have more stories after this quick break. Stay with us. On One News Now, I'm Sean Yao. Senators tackled two bills seeking to protect workers in the media and entertainment industry. Let's get the lowdown from Mann Los Baños, who joins us live from Pasig. Hi, Mann. What were the key points from the hearing today?
Hi, Sean. Good afternoon. Media practitioners like reporters, journalists, cameramen, and crew all stand to benefit from the Media Workers Welfare Act. During the hearing, some senators questioned why government media workers are not covered by the proposed measure. Attorney Perry Solis from the Presidential Communications Operations Office explained that media workers in government entities operate under the Civil Service Law and not the Labor Code. Senator Joel Villanueva called this a flimsy excuse and unfair on the part of state media practitioners. Senator Amy Marcos argued that the current arrangement in the House bills tackled will exclude a poorly paid group of workers and will make the government the chief violator of Labor Code. As for the Eddie Garcia bill, Sean, the League of Filipino Actors President and actor Ding Dong Dantes suggested a 12-hour working cap for actors, crew, and production staff, excluding mealtime, to be included in the bill. Dantes said that the death of veteran actor Eddie Garcia made them rethink policies that will make their working environment healthy and safe for everyone. Aside from this, Dantes also proposed a mandatory written contract for all actors regardless of their role. He said the contract should include the working hours, job description, support, and overtime pay, and items for board and lodging during shoots. Sean, in the same hearing, Dole assured senators that they're inspecting shooting sites to ensure that media practitioners are being treated fairly. Sean?
Thank you for that update. That was Mann Los Baños joining us via Zoom from Pasig City. And the province of Cebu has started implementing a new quarantine model for returning Filipinos after settling its deadlock with the national government on arrival protocols. Dale De Vera with the report.
Janet Sacote couldn't contain her excitement as she's set to see her family after more than a decade. She left her work as a domestic helper in Lebanon to spend time with her ailing father here in the Philippines.
During this, parang inisip ko, ang tagal ko nang nag-abroad, tapos I think ayokong umuwi ng Pilipinas na isa sa kanila hindi ko maabutan.
Sacote stayed in a hotel with other returning overseas Filipinos and tourists from within and outside Cebu. This is part of a new model adopted by the LGU called Multi-Use Model model. Only those who test negative on swab tests upon arrival will be admitted, while the COVID positives will be quarantined in a local government facility. 19 hotels in Cebu are now approved to implement this model, and they're looking to increase the number of available rooms from 3,900 to 5,000. As of now, 5 more hotels have pending applications.
Because of this, we are now very much aggressive in terms of putting rates. If you're planning to come to Cebu, then you have the option of staying either city or the resort.
Meanwhile, some returning Filipinos were left with no choice but to spend for their own tickets to reach their destination, instead of getting OWA to shoulder the cost. OWA Administrator Hans Kakdak admitted that their funds might only last until September. Cebu Governor Gwen Garcia said the province will adhere to IATF protocols after President Duterte announced that the cost of quarantine and RT-PCR tests for returning non-OFWs will be shouldered by the national government.
An additional 10-day stay at the hotel burdens our ROFs. And for this, allow me to thank again the President for announcing last night that the ROFs, aside from the OFWs, will not need to pay the hotels, since this will be answered for by the national government.
But Cabinet Secretary Carlo Nograles said that they will still have to find funding for it. Nograles, Health Secretary Francisco Duque III, and other IATF officials will meet with Garcia tomorrow to discuss the differences in their protocols. For News 5, Dale De Vera, we're One News.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.